again, everyone. Thank you all for tuning in. I am Dr. Faith B.Yisrael, and I'll be discussing this afternoon some of the issues pertaining to PPEs that have become critical as it relates to treating with COVID-19. So if you have questions pertaining to PPE use, if you are a first responder, if you are part of the medical profession who have questions and may have questions, you can type them in. You may see me looking towards my left or to my right. It's because I actually have my laptop set up here because I want to reference a couple documents, and I have other things set up so that I can reference them quickly. If you've also recognized, I have pinned a comment in the live, and that comment includes 4 different links, and those are links to documents that I would be referring to. So you can pull up those links there and follow through if you wish, or you can go and look at them after, because those are some of the documents that I would be referring to throughout the afternoon. We're not going to be here for very long, so let's get to it. Okay, so we are in COVID-19 world, which means we now have a situation where we are treating with every part of the world and practically every country of the world having at least one case of COVID-19, which means we have a pandemic. Pandemic means the disease is in every region and almost in every country. So we have a pandemic. Very quickly again, COVID-19 is the name of the disease that one gets after they've been infected with SARS-CoV-2, which is severe acute respiratory syndrome, coronavirus 2. Of course, this is a virus of the coronavirus groupings. There are several kinds of them, and this is a novel coronavirus, meaning it is relatively new because it kind of came on stream late 2019, so it is a relatively new virus, new version of the coronavirus. There are several strains of it, alpha, beta, delta, and so forth, but we're not going to go into any of that because that is not absolutely necessary for what we are going to talk about this afternoon. So, one of the things that I wanted to start with is for us to do a sort of a OSH. If you've been in any of my OSH classes, you know that the hierarchy of controls is one of the things we look at all the time in occupational safety and health, because that is the listing that tells you what we are supposed to do at different levels to ensure that our staff, to ensure that our workers, to ensure that we are humans are safe. Hierarchy of controls, depending on which model you look at, has 4 or 5 or 6, depending on which model you look at level. The first level of the hierarchy of controls is, of course, elimination. And what that means is we are responsible for ensuring that our workforce is as safe as possible. And if what we are doing, we can completely eliminate the thing that will get us hurt or that will make us sick, then that is the first level, elimination. So we do all that we can to eliminate, to remove the thing that can make us sick, that can have negatively affect our welfare, that can negatively affect us. That's the first level of the hierarchy of controls. The second level refers to substitution, which means we are substituting one thing that may be very dangerous for something else that is less dangerous. For example, if you are a woman and you're into cleaning, or if you're into cleaning, you don't have to be a woman. That was a very gender insensitive statement. Some of us like Clorox, but we know Clorox is very caustic. So you can substitute the Clorox for vinegar, because vinegar cleans as well, but it is not as chemically dangerous as the Clorox. So you substitute the vinegar for the Clorox. So that's the second level, substitution. The third level refers to what is known as engineering controls. And what that means is you can't remove the hazard. You can't substitute the hazard. So you have to work around the hazard to ensure that you design your space, or you design your work environment in a way that allows you to remove as many people as possible from being affected by the hazard. And one of the ways that is done is through isolation. Now, I want to stick a pin in that just a little to let you know that we are going to come back and chat about isolation and what that means in this COVID-19 world now, as it relates to one treating with patients, and how you and how you have patients in a health facility, because that is an isolation kind of situation. Going down again, we have administrative controls, which really are the things that you do to change the way you work. So you may put up a sign that says a danger, so that people can read that in that area is a danger area. That is that's an example of an administrative control, a sign that says a danger, don't go in there. And the final level of the hierarchy of controls is using PPEs, personal protective equipment. And when we say that is the lowest level, it means that when you use PPEs, as the word says, personal, meaning you are only protecting yourself. When you use a PPE, it is to protect you, the individual. The other hierarchy of control measures protect more than one person at a time. So the elimination, the substitution, all of those things protect more than one person at a time, while the PPEs only protect one person, the person who is wearing them at a given time. So when you get to PPEs, hopefully it is because you have already done all of these other levels of control, and you've recognized that you still have not gotten rid of the hazard, you still have not minimized the risk. So you still need to give the individual something to protect themselves. Okay, I wanted us to pay very special attention to that, because if you are in a workplace where the first line of defense is a PPE, then you are not doing all that you can to protect your workforce. Okay, now that I've said that, I want to go back specifically to this whole idea of isolation, because it's a word that has been coming up very frequently. Many people are using it correctly, many people are not using it correctly, many people are misinterpreting what it means. So I wanted to spend a little bit of time on that specific control measure, isolation. Now, when we're talking about somebody who has COVID-19, meaning we have tested them for SARS-CoV-2, the test comes back as positive. We know that they are a confirmed case. We isolate them, meaning we keep them away from other people, because we know that the virus is very, very, very infective. We know that it spreads relatively quickly. So we keep those people who we know have the virus away from other people. Okay, so that is what isolation is. Keeping somebody who is sick away from other people who are not sick, or who are not sick with that particular disease. That is why we keep saying that we isolate sick people, but we quarantine well individuals. We quarantine those individuals who have been exposed to the disease, but we have not tested them yet, or they have not shown any signs and symptoms yet. So we don't know for a fact whether they have gotten infected or not. So we have isolation in that regard, as it relates to separating the patient from everyone else. but we also have quarantining, which is what we are asking the 20,000 people who've come back to Trinidad and Tobago over the last couple of weeks. Some of you are at home self-isolating, some of you are in state-sponsored institutions and isolating and quarantining in those institutions. So you're either home self-quarantining or you're in a state-sponsored quarantine facility. Now, the other time that we have been hearing the word isolation is when we talk about what happens with some of the COVID-19 patients, particularly as it relates to what happens with them at health facilities. I remember a couple weeks ago, there was the former Secretary of Health, Wellness and Family Development took a couple medical professionals, not a couple media personalities, and took them to several what she called isolation rooms at the hospital. Now, the thing about having isolation rooms within a health facility is that you need to be critical of two main things. If the room is within a facility where other people are, you need to have a room that is completely separate from the other rooms as it relates to air flow. Now, why is this critical? Because in those rooms, if the person who has COVID-19 is being ventilated or having an intubation done or any of those kinds of procedures, the possibility is that the virus can now become aerosolized, meaning it is now in the air. If it is in the air, it means that if that room is connected to other rooms where there is a free flow of air from that room to other rooms, it means that this virus can then travel to the other rooms. Now, that is why when we talk about isolation rooms and talk about real isolation rooms, we're talking about rooms that have what is known as negative pressure. Now, negative pressure means there is less, the pressure in the room is less than the pressure outside of the room. And what that does is allows air to come from inside, to come from outside to go into the room, but it does not allow air to go from in the room to go back outside. And we could see where that is critical, particularly if you are talking about being in a hospital, for example, with other patients who do not have COVID-19, then you want to ensure that if by chance any of the virus that person has becomes aerosolized because of the kinds of procedure we're doing with that patient, that air does not make it out to the other parts of the hospital. So that is critical. There are ways of doing it. The room needs to be sealed. There needs to be special control of the air. There needs to be ventilation of that air that takes it out to a safe space and disposed of correctly and so forth. So there are ways of doing this even within a health facility, because in some instances you do not have the ability to put those patients somewhere else, particularly if it's a situation where you don't have many patients like that. It may not be a wise use of resources to have a full separate location to house those patients. So what is done is that they put them in the isolation room that has negative pressure. Now, the other critical part about an isolation room and using an isolation room is that you need to follow standard operating procedures as it relates to being in and around isolation rooms, which means any and everybody should not just be going into those rooms. No, they are isolated for a reason, because you need that room to be secure and separate from everywhere else. You cannot have random people going in and out of those rooms without following the necessary procedures, because it means that somebody who went into that room may actually then be contaminated if they did not have on the proper PPEs, and then take that contamination outside to the other other rooms in the hospital, which means the other sick people are now at risk. Now, that is also very, very critical, because remember what we've said with COVID-19 is that the people who are most at risk for having very severe symptoms and even death are the ones who are, one, over the age of 60. They are the ones who are dying more frequently, and those with other comorbidities, meaning other sick people. So particularly when you are in a hospital setting and you have an isolation room in the hospital setting, you have to do all that you can to ensure that you do not cross-contaminate and have people and have things coming from the isolation room and then going back and mingling with the other areas of the hospital. That is absolutely critical, that we need to have that very clear. And honestly, I am not sure whether when we speak about isolation rooms in Tobago, whether that is actually what we have at the hospital. Which is why it is critical for us to then think about other ways of isolating patients who are COVID-19 patients. Now, in Tobago, we have been blessed with having several health facilities all over the island. At last count, we had 22 or 23 health facilities, so either health centers, enhanced health centers, or hospitals. We've had that many. On any given day, many of these health facilities are not maximally used. As a matter of fact, there are some health facilities that see no use for most of the month, and you only go there when they have a special clinic in that village for that area. One of the things we could think about doing in Tobago to combat that isolation, to have that kind of isolation, really is to probably identify a few of these health facilities, outfit them, and have the patients who are COVID-19 at those facilities, so we do not have them going to the main hospital where all of the other sick people are. That's one of the things that we have to do. That's one of the things that we have to start critically thinking about, because if we keep sending them to the hospital, then we have the possibility of contaminating the entire hospital. And Tobago does not have the luxury of having an entire hospital contaminated because we did not do the right thing, when we have other facilities that we can use to house people who are COVID-19 patients. Okay, so that's why I wanted to spend a little bit of time to talk about the fact that we do have these hierarchy of controls, and we have to figure out how to use them to protect the workers, but we also have to think critically about how to use them to protect the people, protect the nation, protect the island. That is what we have to look at. So that's that part of it. I also wanted to draw our attention, critically draw our attention to two documents that I have posted in the pinned comment on this live. There are two documents. One of them is the Ministry of Health's document, and if I am not mistaken, this document was published in 2011, I think. I don't quote me on the date. But this document was published some time back, and it is the Ministry of Health, and the name of the document is Infectious Prevention and Control Policies and Guidelines for Health Care Services. So this document is really a very comprehensive document. Even though it seems to have been published quite a while now, it is very comprehensive. And because infectious control has been sort of a standard thing for quite some time, even though it's a little bit old, it still follows many of the necessary guidelines. The other document that I want to draw your attention to is a document that was created recently by the World Health Organization. The publication date is the 27th of February 2020, so this is very, very recent. And the title of this is just a maybe two or three pages document, is Rational Use of Personal Protective Equipment for Coronavirus 2019. Rational Use of Personal Protective Equipment for Coronavirus 2019. Now, I want to use these two documents and bring them to your attention to show that a lot of what we need to do has already been outlined in other places. And in Tobago, and dare I say in Trinidad and Tobago, a lot of what we have to do is really just implement what has been outlined in these documents. Now, I want to start with the Ministry of Health, with the WHO document. Because what it talks about is the fact that in the world right now, unfortunately, because COVID-19 has become a pandemic, we have a shortage of PPEs in the world. You see in New York and in the US and other states in the US where they are asking people to help them make masks because they are running out of masks. They are asking, you are seeing where they're talking about reusing PPEs because they are running out of them. I raise that because we have a situation here in Tobago when we need to ensure that we use the PPEs that we currently have wisely. We need to use the PPEs that we currently have and use them wisely. We do not have the luxury right now of just having gloves walking around in our pockets when we are not going to be using them, or hoarding them when we need to ensure that the people who absolutely need them have access to them. So that is critical. That is absolutely critical, because we don't want to become like what we are seeing out there, where we panic right now and we use up our PPEs right now, and then 2 weeks down the road, when we have a large volume of cases where we have, the epic curve is going crazy, that we don't have PPEs to use then. So we need to be absolutely wise with how and when and who uses PPEs. Now, let me just highlight three recommendations that the WHO talks about for ensuring that we rationally use the PPEs that we have. One, the first is to minimize the need for PPEs. Minimize the need for PPEs. The second, and I'll just speak about them quickly and then come back. Ensure that PPE use is rationalized and appropriate. And the third one is to coordinate PPE supply chain management so that we are getting the PPEs when we need them. So the first one is minimize the need for PPEs. Now that is critical, because we are in a different time. We're in a new time, and we need to critically think about how we do what we have been doing. We are in a situation now where if you do not have to seek medical attention, you should not seek medical attention. Because if you are going up just because your elbow hurts a little, remember, you are now going into a space where the doctor or the nurse now has to take time to interact with you. Depending on the situation, depending on what's happening with you, they may then have to use a glove or use a mask with you. Now, if it is a situation where you do not need that kind of care right now, it means you need to not go and get that kind of care right now. Another way for that to happen is for us to really think and be smart and use technology to our advantage. In many instances, some of the interactions that a medical professional may have with a doctor does not necessarily need to be face to face. I am at home in my house right now and I am chatting with all of you. You are hearing me. There are other programs that we could use where we could communicate back and forth and have a discussion back and forth. So using telemedicine or using some of those things are important. Another thing that we should think about doing, even though we have reduced the number of the number of clinics and so forth that we have at the health centers or at the hospitals right now, we could really think about all of those patients that are stable, that have chronic diseases that are stable. Instead of giving them the typical 1 month, 2 month, or 3 month prescription, and therefore they have to come back and get it filled a month, 2 months, 3 months from now, and have to get a clinic date. Because we are in COVID-19 and we need to treat with this right now, we could call in those people really quickly, give them 6 months prescription, and let them be out of our health system for 6 months. If there is really a critical issue that they need to come in, then they can come in. But they should not need to come in just because their prescription is done and they need it refilled. So we need to really think about that. That is just something that we can do quickly, something that we can do within a matter of a very short space of time, ensure that all of those people have medication. So we limit having them to come into the health facility. And that is one way of minimizing the need for us to use PPEs. Another thing that is critical is that our health care providers need to be comfortable and need to be well trained and need to understand when, why, where. Because we have a situation now where I am feeling it. I am getting it from people who are health professionals. There is fear. There is discomfort. There is disquiet. Because that is happening, you may actually have health professionals who are quick to use PPEs when they don't need to use that particular kind of PPE. So we need to figure out how to get into the psyche of these health professionals, which includes training, which includes listening to them, which includes, when they say they need PPEs, instead of just saying, no, we don't have any, or you would get, or it is coming, find out exactly what they need the PPEs for, because that may be an opportunity to do learning, opportunity to do teaching, so that we truly understand when and where and why to use our PPEs. Ensure that the second one is ensure that PPE use is rationalized and appropriate. And again, it goes back to that. I would go through very quickly some of the critical points from the Ministry of Health's Infectious Control Manual, and that identifies when we need to use what kinds of PPEs, because that is critical. Even though we have the N95 mask, by no means do we need everyone walking around with N95 mask over their faces if you are not doing something that requires you to need an N95 mask. So that kind of training is absolutely necessary. And the third thing that the WHO says is we need to coordinate PPE supply management, because that is critical. We need to ensure that we actually get the PPEs that we need when we need them. Now, I have been getting word from all levels of health professionals telling me that they are not getting PPEs when they request it and so forth. And I have also been getting word that PPEs are coming. They are coming. And I don't know if the PPEs that were coming since last week and the week before have actually gotten here yet, which means we need to rethink where we are getting them from, how we are getting them. I heard the Minister for Health recently boast about all of the PPEs that are coming in from wherever they're coming from, whether it's from the WHO, whether CAFA is coordinating, wherever. But it seems like even when those come in to Trinidad, they don't make it to Tobago. And that is something that we need to figure out how to fix. Because the same way our Trinidad counterpart health professionals and first responders need PPEs, our Tobago counterparts need PPEs too, and need to feel that they are protected. Because the worst thing that could happen to us is having this COVID-19 thing get out of hand and not having our health professionals on our side because they are afraid for their lives. Remember, they signed what they call the Hippocratic Oath, which means first do no harm, do everything that you can do, but that oath does not say they have to be stupid and they have to put themselves at risk. So we have to ensure that they are as protected as we could possibly get them protected, and of course using the other things we spoke about before, and ensuring that we have the right PPEs at the right time is absolutely critical. So if our people on this side, in the THA, in the TRHA, know that the PPE shipment that should be coming has not gotten here yet, we need to stop playing nice and we need to figure out how to get it here. Even if it means sending somebody down because for whatever reason who coming up hasn't come yet, sending somebody down to get it. Even if it means at this point that we need to fly and go somewhere else to get it because that is what it takes, we need to start critically thinking about what we need to do and not just sit and wait for it to come. We don't have the luxury of just waiting for it to come. We can't do that. We absolutely cannot do that. And they need to start being better negotiators. They need to start playing hardball. They need to start using whatever tactics they need to use to ensure that our healthcare providers and to ensure that our first responders in Tobago are properly well equipped. Because as much as we need their help, they need to be safe. They can't be getting infected and then going home to their families. We can't expect that of them. The oath does not tell them to be stupid. It doesn't tell them that. So I just wanted to highlight that particular part of it. Now, part of the WHO manual also speaks to the fact that having isolation units is critical to treating with COVID-19 too, because you do need to ensure that the people who are treating with possible patients or with patients are very well trained and they have the necessary PPEs, and then you can leave the other health professionals to treat with the regular issues that Tobagonians and Trinbagonians have. Let me just take a sip of water. So that's important. Let me go quickly then to the Ministry of Health's infection prevention and control policy that I thought was quite interesting, and it is very important. As I said before, if you joined the live after, I have pinned the links to some of to these documents that I am referring to. The links are pinned on this live, so you can go to them there and look at it. I also I want to say that I will not be doing any actual donning and doffing of PPEs as in demonstrations, because we have demonstrations on YouTube all over for that. So even if you are not sure exactly what to do, I've also given a couple links on YouTube that you can look through to see exactly the correct way to put on the glove and the correct way to take off the glove, the correct way to put on the mask, take off the mask, and so forth. Okay, so I just wanted to highlight that. So let's go to the infectious prevention and control policy of the Ministry of Health. Now, and I want to read a particular paragraph because I think this sets the tone and it lets you know what else is what is entailed in the policy. It says the 2007 CDC guidelines for isolation precautions in hospitals contains 2 tiers of precautions. In the first and most important tier are those precautions designed for the care of all patients in hospitals, regardless of their diagnosis or presumed infection status. Implementation of these standard precautions is the primary strategy for successful healthcare associated infection control. In the second tier are precautions designed only for the care of specified patients. These additional transmission-based precautions are used for patients known or suspected to be infected or colonized with epidemiologically important pathogens that can be transmitted by airborne or droplet transmission or by contact with dry skin or contaminated surfaces. Now, I wanted to read that because it shows that what we are talking about is 2 levels of protection, 2 levels of infection control within the hospital. We have the first level, which is what everyone should be doing. The term we've normally used is universal precautions, which means treat everybody as if they have everything, because you don't know what they have and you don't know, so you need to treat everyone as if they have everything. Those are the standard precautions, and those are the first tier precautions. And then you have those that are specific, which is if you are, for example, in an isolation unit, or in, for example, we have Couva Hospital and Cora Hospital in Trinidad, where our COVID-19 patients are going, then they automatically fall into the second tier because they are dealing with these special kinds of situations. It's important to note, though, that depending on how this epidemic fulfills itself in Tobago and in Trinidad and Tobago, we may get to the point where so many people are infected that the first tier precautions need to be second tier precautions, because we don't know who we are coming in contact with, and the rate is so high that it is very likely that if you come in contact with someone, they have COVID-19. And that's why one of the things that I spoke about this week at our sitting at the Tobago House of Assembly legislature, one of the things I spoke about then was ramping up our testing here in Tobago, because what we've recognized is that the other countries that do more than bare minimal testing, the other countries that do more than just test people with travel histories and COVID-19 symptoms, and those countries, for Germany, for example, Iceland, for example, has gone past that and has actually just been doing surveillance testing, which means testing 1 in every 100, 200 people, regardless of whether they whether they have signs or symptoms or not. That is where we need to be to ensure that we know what this disease actually looks like, and to ensure that we are nipping it in the bud very early. So I just wanted to bring that to your attention. The standard precautions, according to this Ministry of Health manual, it includes several things, and I would read them quickly and then go back to a few. Hand hygiene, respiratory hygiene, which is cough etiquette, personal protective equipment, which of course includes gloves, goggles, face shields, respirators, safety sharps management. What do you do with the needles after you've used them? Occupational health and bloodborne pathogens, dealing with that. Environmental control, patient care equipment, patient placement, where do you place different kinds of patients, patient resuscitation, and linen. How do you treat with linen, bed sheets, and those things? So it starts with identifying the fact that, of course, what we've been telling Trinbago all the time is that hand hygiene is critical. And let me take a second to just explain why that is the case. Soap, the virus, the SARS-CoV-2, has a little encapsulation around it. It has a little encapsulation around it. The good thing is that regular soap, any kind of regular soap, causes that encapsulation to rupture. When that encapsulation ruptures, the virus dies, because it needs to be protected in that little skin, for want of a better term. So washing your hands, as simple as that may seem, is actually one of the greatest fighters against COVID-19, because the soap causes the skin to rupture, it causes the virus to then die, and then when you use water to wash it away, you then wash that away down the sink. So that is why washing your hands is so absolutely critical. It is a simple thing that we need to do, and it is really a first line of defense for all of us. Whether you're a healthcare professional or not, you need to be washing your hands with soap and water continually for at least 20 seconds, because that is how long it takes to get all the different parts of the hand. And as somebody says, so I'll go back to the points. When I am done, I would go back and go through all of the points. But someone just says, we have community spread, so surveillance testing is now a waste of time. We needed to do wider testing. We need to do wider testing. We need to do wider testing. So at the onset, what I am recommending right now is, and I will continue saying it, I don't care how many people say or how many people think that Tobago does not have the capacity, because we do. Tobagonians are as smart as anybody else. The Minister for Health last week, last week, spoke about the fact that in addition to the CARFA testing site in Trinidad, which is the only authorized testing lab in Trinidad and Tobago and in many of the Caribbean countries, that several additional machines were coming in, and that they were going to ramp up testing by having testing done at the Eric Williams Medical Complex and having testing done at the Trinidad Public Health Lab. And he also spoke about other machines coming in. And one of the things that I have been pushing for is, why can't one of those machines come to Tobago? Because we have, at that point, we would then have 3 or 4 in Trinidad and still none in Tobago. What currently happens in Tobago is that they take the swab and they send the swab to Trinidad to be tested. That is what currently happens. And there is no reason why we can't set up a testing facility here, because the same way we did not know how to test for COVID, for SARS-CoV-19, SARS-CoV-2 a couple weeks ago, but we had people come in, bring in the machines and teach us what to do. We can have people come in, bring in the machines and teach us what to do in Tobago too. We have lab techs, 1 and 2s here, that can be trained up and learn how to do this. And we also need to look at redundancy, because we need to figure out, if something happens in Trinidad that shuts that system down, we need to have a backup plan. And Tobago could be that backup plan. So that's critical. The hand washing is absolutely critical, and it goes on to show how you wash your hand and all of those things, when you're supposed to wash your hands and so forth. Let me quickly go through the other options. It even tells you how to wash your hand before surgery, before putting on a glove, and all of those things, because hand washing is a critical first step in treating with this. Then we have respiratory hygiene, which is cough etiquette. We all know by now. I hope no one is coughing into their hands anymore. I hope we are all coughing into a tissue and then throwing the tissue away. And if you happen to not have a tissue, you're coughing into the crook of your elbow, and then washing your hands, wiping your elbow when you're done, and all of that, because that is critical. And let me explain really quickly why that is critical. Because most of the cases, even though the virus in itself is encapsulated in a little shell, the virus needs something to travel in, and the thing that it seems to be traveling in is mucus droplets, those wet things that come from our mouths or our nose. So the virus multiplies inside of us, gets into those droplets. When you sneeze or when you cough, you feel the wet thing on your hand, if you've ever coughed into your hand, and that is where the virus now is, on your hand. Of course, if you now then take your hand and touch something else, the virus now is transferred to that other thing. And depending on the kind of material that thing is, it can then, the virus can live on that material for a significant amount of time, several days. There's a study coming out now that shows that one of the cruise ships where they had the big issue with in late January, early February, that they found that the virus actually lived on some surfaces on that cruise ship for up to 17 days. So that is the kind of thing we're talking about. So even if you were not the one who sneezed, if the person who sneezed then touched the surface and then you go and touch it, and then you go and touch your eyes or your nose or your mouth, then it can get into your system. So that is critical. And then the crux of the matter, as the old people say, is how do we use the PPEs? How do we use the PPEs? There are different kinds of gloves. There are different kinds of gloves. We have the single-use gloves that you buy. I'm hearing bikes passing. We have the single-use gloves that you can buy in a dime a dozen. They come in the boxes. You pull them out, latex powdered and whatnot. So there are those that are supposed to be single-use gloves. There are some places in the world now that because of the horrible shortages of PPEs, they're actually using them more than once, which is crazy. And I hope to God in Trinidad and Tobago we never get to that point. But those are supposed to be single-use gloves. We also have the sterile surgical gloves, which are the gloves that you put on. They come in the sealed pack that you have to actually rip open the pack and get those sterile gloves, and they use those when you need to actually go into use that to go into a human being for an invasive procedure. And then you have the heavy duty gloves that are usually reusable, and those are the ones that you find people who are responsible for maintenance and cleaning and those kinds of things. Those are the gloves they use that can be reused, can be washed, can be disinfected, can be sanitized, and then use them again, right? Ideally, this document says that if you are using single-use gloves, you should only be using them singly, once. You should only be using them once. So you should only be using them once. If you are doing a procedure where you are coming into contact with the mucosal membrane, so you are doing something where you're coming into contact with the nose or the mouth or any of those, or you're coming into contact with a bodily surface that is moist or that is wet, then you definitely need to use those gloves. What is recommended is that right now, if you are not coming into contact with any broken skin, you're not coming into contact with anything, you are just, for example, sitting at a desk chatting with somebody, you're not touching them, you're not really interacting with them, then you really don't need to use the glove if you are in a healthcare facility, a healthcare setting. So whether you use the glove and which glove you use is based on the kind of procedure that you are doing. If you are just there signing forms, then there is no reason for you to use the glove. So that is something we have to be critically think of, because again, we don't want to use up the PPEs that we have right now and waste them, and then 2 weeks down the road when we absolutely need them, when a doctor who is really interacting with somebody who is sneezing or coughing or whatever, and they need the gloves, they need the face shields, we don't have them because we use them up now. Okay, so again, you need to be changing gloves. This manual tells you when you need to be changing gloves, when you're changing tasks. So for example, if you're doing something in a patient and you're going from the head to the toe to the patient, you think about it that way, then you would need to change a glove, because you may not want whatever is in the head to contaminate what is in the toe of the patient, because that is what that's an example of nosocomial infections, meaning infections that you get because you are in a hospital. You can get nosocomial infections even from one part of your body to another part of your body, because the bacteria from one part of your body is not supposed to be in the other part of your body. So again, depending on what you are doing, even if it is on the same patient, you may need to change the glove depending on the procedure that you're doing. Ideally, as soon as your gloves are soiled, as soon as any of your PPEs are soiled, you really should be changing them, because that's what you should be doing. You should be changing them whenever they are soiled. And of course, after you've come into contact with the patient, you need to be changing your glove. because you don't want to have a situation where you move from one patient to another patient and then transmit what one patient has to the other patient because you use the dirty gloves on the new patient, right? So those are things that are critical. Again, in the midst of all of this, and yes, somebody just mentioned the washing hands. In the midst of all of this, you still need to wash your hands. In the midst of every time you take off a glove, you need to wash your hand. Before you put on the glove, you need to wash your hand. Moving from one thing to the other, you need to wash your hand. If you are not in a situation where you can wash your hand, then you need to sanitize with the alcohol-based sanitizers, the alcohol-based sanitizers. So let me go back to the manual again, and again, I am really just highlighting some of the critical things that are in this manual, and I left, as I said, the manuals are there for everyone to go and download and read them. It's important to note, though, generally, even though I am not going to do any donning or doffing of PPEs, it's important for you to know that in some instances, not in some instances, in all instances, if you use your PPEs incorrectly, you actually put yourself at greater risk. And that is what we've been telling random people on the street, because you see them with the glove, they've touched a million things with the glove, and then you see them pick up their phone with the glove, put the phone here, so the glove is now practically in their nose, in their face, the same dirty glove, because they just picked up their phone with it. If you have the gloves, and the donning and doffing video on YouTube show it very clearly, there are ways to ensure that you take off the glove without touching the glove, because if you've taken off one glove with one hand and you then use your bare hand to touch this raw surface of the other glove, you have now contaminated your hand with the glove. So those are things you need to be very, very careful of, and not think that because you have on the glove, you are protected and put yourself at most risk. You shouldn't be doing that. Of course, we have the different gowns, the face shields, the mask, and so forth. I want to chat a little bit about the masks, because that is something that is critical, and that is something that is important. Now, there are two main types of masks, two broad categories of masks. We have the surgical masks, which are the ones that you buy them a dime a dozen. They're white. They usually have a little kind of pleats kind of thing. You just put them over your face. You could stick them behind your ear kind of thing. Those masks, are important if you are a healthcare professional and you are interacting with a patient who is exhibiting flu-like symptoms, because it is protecting the large droplets, and I am clear when I said the large droplets, from getting to you, getting into your mouth and into your nose. Okay, so that's when you're using the regular surgical masks, because you are trying to prevent the droplets, the boulders, the spit, the sneeze, the mucus that you get when people sneeze and cough. You need to wear it to protect you from that. We are also recommending in this COVID-19 world that people with flu-like symptoms also need to wear those surgical masks to protect those around them, because a sneeze and a cough could come anytime. If they have it on, then they don't have to worry about spilling it onto other people. But it's also important to note that a lot of studies are coming out showing that even people who are not sneezing or coughing, so they don't have symptoms for COVID-19, they seem to still be shedding virus and still infecting others. How is that happening? When you get infected, the virus multiplies inside of your body. And at certain points, the volume of it is so large that it sheds and it actually comes out in your spit. So I don't know if any of you have ever experienced talking next to somebody who had real mouth water coming out their mouth. Right. So it can come out in that mouth water. Locally we call them boulders. It can come out in the boulders. So the person may not be sneezing or coughing, but the person is talking to you, and because the boulders are coming out, the virus is still coming out. So that is critical. So somebody who has it or is suspected of having it should be wearing that mask when they are interacting with others, because it is a possibility of having a spread. Possibility of having spread. Okay, so that is critical. So there's the surgical mask, but then there's also the N95 mask, which are they don't even call them masks really, they call them respirators. And these are very, very secure. If you go online, just search N95 mask. They are very, very secure. They come in different sizes, so you actually need to be measured to ensure that you are wearing the right size. And those N95 masks are important, particularly if you are in a health facility, because in a health facility, depending on the procedure that is being done on the patient, then the virus could move from being in just those droplets to being what we considered aerosolized. I keep not being able to say that word, aerosolized. The term airborne is actually quite an iffy term right now, and there is kind of a little debate going on between the WHO and the CDC as to whether they want to use the word airborne as in what happens with the virus, because there are other infections, other viruses that are really airborne, meaning they just float in the air and they go on and on and on and on and are able to live in the air all by themselves. But it seems like this one, the risk of it becoming quote unquote airborne or aerosolized happens when you are doing procedures that forces you to push air into the person's lungs. So if you're doing an intubation, if they are on a ventilator, any of those kinds of procedures then cause the virus to be aerosolized, which means they become smaller in the air, and the regular surgical mask will not protect you from that. They will not protect you from that, because so that is why if you are working in a hospital, for example, and you are in an isolation room where they are doing, or an ICU where they have ventilator service, then you need to be protected using that N95 mask, because that is where those droplets, the virus can now be aerosolized and now in the air. Normally, it does not seem as if the virus goes into the air on its own just like that normally. There is still a little bit of question about, let's just say if somebody sneezes and it sneezes into the air, how long those particles last floating around. There's a little bit of, hooing and hawing about how long that is, but that is still not really airborne, and that's still not really aerosolized, because the virus is still inside the droplets, even in a situation like that. But particularly if you are working in an area where you have patients with COVID-19 and where they are doing procedures they're called aerosol generating procedures, then those are the times you need to be very, very careful and wear your N95 mask, which goes back to one of the first things I spoke about, which is ensuring that you have patients who are COVID-19 patients in true isolation rooms or true isolation spaces, because that is what you don't want. A patient who has COVID-19, has one of these procedures done because they are on a ventilator or whatever, the virus is now aerosolized, and because that room is not totally really isolated, those then go out into the other parts of the hospital where you can come into contact with them. That is why regular random people should also not be going into those rooms that should have negative pressure. Yes, negative pressure. And for those who came on late, negative pressure means that the pressure inside the room is actually less than the pressure outside the room, which means that air can flow into the room, but air can't flow out. It can flow in, but it can't flow out for obvious reasons. We don't want the air inside that room that may have aerosolized virus floating around to then go out to the other parts of the hospital or the facility. Which is why it is really, really recommended that if you have patients who are COVID-19 patients, then you really, really keep them in true isolation rooms, true isolation spaces, true isolated walls, or you keep them in a facility that is separate from the general hospital or the general health providing facility. So you know that the only patients who are going to be in that facility are patients with COVID-19, and you can then put your heightened tier 2 PPE procedures in place at those facilities. Again, going back to the WHO recommendation for ensuring that we don't run out of PPEs. Ensuring that we don't run out. So, those are a couple things I wanted to highlight. Let me just go through my notes here. So, I'm seeing here somebody asked about, somebody had asked about what we do or issues pertaining to like disinfecting and reusing PPEs. The reality is that we don't know. In the US, in other countries where they are running out, they are trying different things. They are trying to disinfect. They are trying to use different solutions to see what works. But because this is something that is so new, it's hard for us to definitively say yes, whether it is working or not just yet, because we don't have a long enough time to see the outcome of them doing those things. They are doing them, they are reusing, they are asking people to make masks for them and so forth because they have none. And a little bit of protection is better than no protection in that system, although it may not be the best, the most ideal, it is better than having none. So they are in a crisis kind of situation. We seem to not be we are not there yet, and I hope to God we never get to that point. So we should be practicing the right thing, which is if we are using single use, we use them once. But ensure that if you are using a single use glove or a single use mask, that you use it correctly for the right reason and you are not wasting it. That is absolutely critical. Those people who are up and about wearing masks and wearing gloves just because they don't, because we are in COVID-19 and we are all scared, several people ask me what should they do, and it really is based on your risk assessment. Each category of worker, each category of task, we need to look carefully at the risk assessment for that category and determine whether that person needs to wear it or not. So for example, if you are driving a bus, for example, we have our PTSD buses. We are not taking cash. We are taking the little chits, the bus tickets. We now know that all of our public transport and all of our public transport should have 50%. So even if the bus has capacity for 20 seats, we are now mandated to not carry more than 10 passengers and so forth. Because that is the case, we now have to then think, okay, does the bus driver really need to wear a glove and really need to wear a mask? Why would they want to wear a glove? Is the bus driver touching people coming in? Is the bus driver touching the chits that we get or the bus tickets? If that is the case, then maybe we could think about, again, going back to the hierarchy of controls, maybe have a container in the bus so that when people come, they can just drop their bus ticket in the container, so they don't have to have any interaction with the driver at all. So again, we could think through things like that. But what we don't want is for the driver to have 10 gloves, use out the 10 gloves, have the mask, use out the mask, the other thing about wearing masks when you don't know how to wear them, because most of us are not used to having things on our faces, we touch our face more frequently when we have on the mask compared to when we don't have the mask. So that is the thing. We touch our faces more. So you have on the mask, and because the mask is there, you would normally touch your face 10 times for the day. You are now touching your face 100 times for the day because you are trying to adjust it. You are carrying it up and down. If you've seen anybody take the mask, put it down below the neck or put it above their face, then you've already ruined that mask. You're wasting it. You are wasting it. There's no reason for you. That is wastage, and that is what we don't want to see. That's what we don't want to see. Again, if you are, because up to 80% so far of the people with COVID-19 don't need to be hospitalized. In many instances, they are sent home in the rest of the world to take care of themselves at home because they have very mild symptoms. If that is the case, and you are treating with somebody who is at home, who is sick, then yes, as I said before, that person needs to have the mask. If you are going into the room to interact with them, then you need to wear your mask. Again, keep washing your hands, cleaning the surfaces and all of that, so that you do not become infected just because they are in the space. So that's critical. All right, so let me go through. There's one other thing that I wanted to touch on because it has come up recently in the Tobago space. We have a situation in Tobago where we have a confirmed case of COVID-19 where the person who has COVID-19 is a medical professional. And if you saw the press conference that happened on Friday with the Tobago House of Assembly, the Tobago Regional Health Authority, one of the things that came up at that press conference, which caused everybody to lose their senses, to lose their minds, is the fact that they said that this person who has now tested for COVID-19 was actually at work even though they seem to be feeling sick, which goes against every single thing that we have said in the public domain for the last couple of weeks. And I'm repeating it here. If you have a flu-like symptoms, then do not go to work. Even if you are one of those essential services people, you do not go to work. You call and then you get advice on what to do, where to go. They may come to you, they may tell you to come to them, whatever, to then get tested and so forth based on what your signs and symptoms are. Right? I think what may have happened may be a misunderstanding, because what I know happens in some places is workers, healthcare professionals who are working in these isolation units or in these facilities designed for COVID-19, for example, if that person, if that health professional has for some reason their PPEs didn't work and they think that they were exposed more than they should, instead of sending that health professional home to go and possibly infect their families, those workers usually stay in a facility close to where they are working. So they usually don't go home every night to their families anyway. So that's part of it. But the part about them being possibly sick or getting sick is they continue allowing them to be in the space and in some instances working even if they do not have flu-like symptoms, because the patients that they are working with already have COVID-19. So it's not like you are putting the patients at risk. Those patients already have COVID-19. And because resources, including human resources, is very low in many of those places, there is no point sending that health professional home or to quarantine for 15 days when they are not showing any signs and symptoms and they could be working. Because remember, the patients they are working with already have COVID-19. So you are not putting the patient at any additional risk. So I think that may have been a misunderstanding, and I am hoping that the powers that be figure out that that is not the way to do it, because as a good friend of mine posted on Saturday or whenever, that if we are telling people that it's not okay for regular people to get other people sick, you shouldn't be saying that it's okay for health professionals to get other people sick. That just does not make sense. So let me go through the questions here quickly. I saw several comments. Let me go through them really quickly to ensure that I have answered all of your questions. Let me see here. If you have questions, then post them. I will try to answer. If I don't know the answer, I'll let you know I don't know the answer. Okay, Dwight Cunningham said, is there a community spread happening here in Tobago? So, if you listen carefully to what was said at the press conference on Friday, you can infer community spread. They have not said that, but that is something that you can infer. Because when they asked the question, did the health professional travel, and they had to ask it several times, they finally admitted no, the health professional did not travel. When they asked, and again they had to ask several times, did the health professional come into contact with somebody else who we know is a confirmed COVID-19 case, then after going around and around and around, they finally said no. So the only other option is that that health professional got it from somebody unknown. That is the definition of community spread. So even though they have not said that yet, based on the answers they gave or did not give at the press conference on Friday, we can infer that community spread is happening in Tobago, which means that when we talk about staying home, when we talk about practicing social distancing, you need to be very, very careful, because you don't know if the person you are standing next to is the person who stood next to the person who this health professional got it from. We don't know. That is why it's so important for us to really, really do that social distancing. Stay home if you don't have anything to do. Stay home, stay home. If you know you're one of those 20,000 people who've come into the country within the last couple days, then you need to be self-quarantining, which means you need to not be on the block climbing. It means you need to not be even in your kitchen hanging out with your family, because remember, if you are the only one who traveled, we need to ensure that you have not gotten infected. If we don't know yet and you are interacting with your family members, you can then infect your family members. And remember, if they are not self-quarantining, they can then go out and infect other people. So we need to be very, very, very careful. I'm going through the questions again. Somebody asked about my fowl. Yes, I live in the country part of Tobago. I have fowls. Well, I don't have fowls. They're outside. How do you address the unique circumstances of emergency medical service providers? Well, emergency medical service providers are people who are, so EMTs, EMSs, are the ones on the ambulances. You are the ones who need to be extremely careful, because you don't know who you are picking up. So you may get a call because somebody's, you don't know. So you need to be careful. I am hoping that our ambulances are so designed so that even if the driver of the ambulance is not completely PPE'd down, that the ambulance has a seal so that there is no transfer of air between the back of the ambulance and the front with the driver. Because in many instances, the driver is the driver. The driver may not be interacting with the patient. If the driver is one of those that needs to interact with the patient, then the driver needs to ensure that he or she is wearing PPEs. But he or she also needs to know that the time between interacting with the patients and going back to driving, because you don't want to then contaminate the driving space. So you would then need to follow the protocols as it relates to taking off the PPEs and so forth before going back to driving the ambulance, for example. But definitely the people in the back, the EMT in the back, the AMS in the back, who is interacting with the patient, you need to be full PPE down. Because we are in Tobago where the procedures that are done in the ambulances are not invasive procedures. You don't necessarily need to have an N95 mask on in the back of the ambulance, because it's not like you are in the back of the ambulance intubating the patient or anything like that. Okay, but again, if that is not the situation, and if you're in Trinidad and you are in an ambulance that is doing that kind of stuff, then certainly you need to follow the PPEs, the procedures as it relates to that. Following, looking at the questions, there's a tent now outside the hospital. Is it for isolation or quarantining? So the tent that is outside the hospital actually belongs to TEMA, our Tobago Emergency Management Agency. That tent is being used as a separate space to triage. Well, let me not say that. I think now, because we have figured out that the person, the health professional who was the confirmed case, may have been working in A&E, I think the time now they are sanitizing and cleaning A&E, they are using that tent outside, almost like a first stop kind of thing. Generally, it is used to screen people. So everyone who comes in, go in there, make sure you don't have cold and flu symptoms, because you don't want people with cold and flu symptoms to then go into A&E and mingle with everybody else who is there for other reasons. So it should be out there to use as a triaging station. I can't confirm whether it is a true isolation unit in terms of negative pressure. I would have to ask the officials at TEMA to see if that is the case. But I am not 100% sure of. So there are complaints about, so yes, so there are questions about whether the incubation period of the virus is really the 14 days, because that is what we've been using. That is what the data seems to show now. That incubation, and let me just explain quickly. Incubation period is the time between when you come into contact with the virus and when you start showing signs and symptoms. Okay? So for most people, the incubation period could be 2-3 days. For some people, it goes all the way up to 14 days. For most people, and I think it's like a 98% confidence interval, shows that most people are, if they are sick, they have shown signs and symptoms up to 14 days. So that is a period that we have been looking. Of course, that means there will be people who show signs and symptoms after the 14 days, but that should be in the minute amount. The thing we need to be very concerned about, though, is the fact that some of the studies now are showing that there are a good proportion of people who have been infected and have the virus inside them and show no signs and symptoms whatsoever. And that is something we need to be concerned about, because it means that they can still spread the virus. They can still shed. They still have boulders coming out of their mouth when they talk, and they can still infect other people, which is why I have strongly suggested that we need to move away from just testing people with COVID-19 symptoms and start on the first instance with testing everybody with flu-like symptoms, because flu-like symptoms could be what we consider mild COVID-19, and they may just express as flu-like. So we need to be testing everyone with flu-like symptoms. And next step should be just randomly testing people, just to make sure we don't have people in the society with COVID-19 who don't have any symptoms whatsoever. That's the only way we would really know whether we are arresting the situation and whether we are truly fixing the situation. It says the government have no PPEs because the money allotted, because the money was now allocated and health workers are left unsafe. And unfortunately, that is those are the reports that we've been getting, because I've gotten comments, I've gotten messages from health professionals telling me they have been asking for PPEs and they're not getting them. And I'm trying to figure out why they weren't getting them. Is it that they didn't have or not? They don't know. And again, that is also, again, messing with the psyche of our health professionals. We don't need them to be concerned about going to work and not having a glove when they absolutely need a glove, which is why they need to fix that chain of getting the gloves or getting the PPEs. Again, the Minister for Health was very, very boastful last week, talking about all of the hundreds and thousands of PPEs that are coming in. So I'm really, really hoping that that trickles to the health professionals, and particularly the health professionals in Tobago. All staff trained on how to use them. So that is a tricky question. Technically, if you are working in a health facility, meaning you are a doctor, nurse, enrolled nursing assistant, so forth, training on how to use PPEs should be part of your training before you became a health professional. So what we need to do, though, is to have refresher courses. And now that we have COVID-19, it means that people need to really, really be practicing over and over and over and doing it, and not be as complacent as we may have been before. Seeing a lot of public using the N95 masks and have no clues that each person in the healthcare field is okay, no clue. Right, so somebody was saying they are seeing people using N95 masks and they didn't realize that you need to actually be fitted for N95. So yes, so they may be wearing an N95 mask and it is not the correct size for them. As a matter of fact, if you can walk around with an N95 mask comfortably, then you're wearing the wrong size. That's just the way it is. Because the way those masks are created, there is supposed to be complete suction, almost stuck onto your face. It actually takes effort to wear an N95 mask. So if you just walking around wearing an N95, and those things are expensive, if you're walking around and you could comfortably walk around with an N95 mask, something is wrong. You're actually not wearing it correctly. It's not the right size for you, and you need to not be doing that. You need to not be hoarding, because again, in 2 weeks we may really, really, really need those N95 masks, and we may not have access to them because you will playing the fool with it. So I'm continuing. If there are any other questions, remember to continue. I'm going through the questions. Isn't the THA Secretary for Health part of the national effort on COVID-19? Should be. I have heard that our reps on the National COVID-19 Task Force include the County Medical Officer of Health and another person. I can't remember who was the other person they had identified. But remember, these are policymakers. The politicians are policymakers, so they need to be in contact with their technocrats all the time, and they need to also be advocating. So the things I am talking about now, particularly, and I'm going to be very political with this one, particularly since we have PNM in Tobago and PNM in Trinidad, we should not even be fighting for these things. These things should be automatic. We should not have to even argue that we need at least one testing kit or we need ventilators. Oh, by the way, about the ventilators, again, I understand, and again, because the Minister of Health was very, very boastful last week about the number of ventilators coming in. There were about 75 coming in from 3 different sources, and then he identified another 50 to 100 coming in from another source. We need ventilators in Tobago. We need ventilators in Tobago. This should be an easy thing. And yes, the politician in Tobago should be talking with their politician in Trinidad counterpart for these things to come quickly, because it is the Minister for Health who I heard on television boasting about these things. So I'm continuing. Sorry about the rant, but it is kind of annoying, to be honest. It is kind of annoying. Healthcare professionals putting their lives at risk, and we're thanking you, but we're also saying we're not telling you to be stupid. We're not telling you to be stupid, because if every healthcare professional puts their lives at risk and then gets infected, the rest of us also suffer, because there will be no health professional to help my mommy and granny and everybody else who needs a doctor and a nurse. So that can't be, you can't put yourself at undue risk, and then that ultimately cripples the system because we have a sick healthcare task workforce. Somebody had asked whether N95 masks are single use. Yes, and N95 masks actually have a time limit. So there are other kinds of respirators, but it's usually like 4 to 6 hours depending on what you're doing. But as I said before, in many of the they are single use, and in many of these circumstances, the activity that you are doing with them shouldn't last you 4 or 6 hours, because you are using it because you are around a situation where a patient is having a aerosol generating procedure done. Unless you are working in a health facility that is purely COVID-19 and you have 10, 15, 20, 100 patients. So that way you may then need to keep your N95 mask on, because you're doing multiple things with multiple patients and so forth. Trinidad and Tobago has thousands of test kits, but we've only used about 500 thus far. Exactly. I'm not sure what we are waiting for, why we are not modifying our protocols to determine who needs to be tested or anything like that. Training is essential. Yes, we are depending on Trinidad too much. Okay, so going through the questions again, if you have additional questions, let me know. I want to make sure I cover. I see that I'm actually way past the time that I was supposed to be on. It was supposed to be an hour, but I guess I ramble. Are masks effective in protecting people on the street? Oh, so let me answer that, because that is critical. Because of where we are right now in terms of how many people have it, because most people use the mask incorrectly, it may not be protective right now. If we were in China, for example, where you were seeing everyone walking around with a mask, it's because their infection rates their incidence rates in China were so high that it's possible that every other person really did have it or is going to interact with somebody who has it. So that was critical. In Trinidad and Tobago right now, we are not there yet. And particularly if everybody follows the rules that we are telling people of social distancing, stay home if you are a non-essential worker. And I know that list of essential workers provided by the government was the longest possible list of essential workers on God's green earth. But even if you are on that list, you need to work with your supervisor, whoever, to figure out can you work at home. We have computers, we have internet, we have things we can do at home. We can have conference calls on Zoom or on Google, or all of those things are a possibility. So you need to work to ensure that we stay home. And if we all stay home and not interact unnecessarily and stop the spread of the virus, then we would not need to be walking around with masks all the time. We would not need it, and that is where we're hoping to be. So gloves and masks give a false sense of security. Exactly. Social distancing, even if you feel silly doing it, and insist that people around you do the same. Now that is critical, because we are a fun-loving, comfy, near people. And I have actually been in situations where on Friday, for example, I had to tell people standing outside a bank, all you're standing too close to each other, spread out, because they were bunched up in front of the bank, in front of the door. Now, when you go in the bank was practicing social distancing inside the bank, but all of those people were bunched up outside. I remember going to the drugstore last week, and dude was right next to me. I had to turn around and tell him, excuse me, you really need to stand back quite a bit. So it was rude, I'm sorry, but in a situation like this, I don't need you breathing down my throat. As a matter of fact, I didn't need you breathing down my throat last week or the week before the other time, but at least now I have a legitimate reason to turn around and tell you, step back, push back. I read in the WHO site that is airborne for 3 hours. So yes, that is where they are. So it's not airborne, but the droplets float in the air, and they can float in the air for up to 3 hours. That's the average now. It's not 100% certain yet. And again, a lot of these things are, it's an evolving thing. You learn more about it as you go along, because as more time goes by, we are able to learn more. All right, so let me go through quickly. Negative pressure, mask. All right. Ian Allen was not the only idiot then. Well, no comment on that one. So there are questions about the staffs that has been working with them. Are they still working? Ideally, they should not, and I hope that that is what they're doing. They're trying to figure that out. But I don't know. They should not. They should not at all. Let's see here. Just going through, making sure I haven't missed any questions, and I think that's it. So guys, again, it's critical that we understand who, what, where, and when should be using PPEs, which I went through. Share the live with others. If you have come on late, there's a pinned comment on the live that includes 4 links. 2 of them are YouTube videos showing how to don and doff PPEs. The other 2, one is the WHO document, the other is the Ministry of Health Infectious Control document. Both are critical, particularly if you are a healthcare professional. Definitely use it. If you are a first responder, definitely use it, because that's important for you. Again, before I go, I want to encourage all of us to keep washing our hands. Yeah, all of that. And you see how quickly I did it? You shouldn't even be doing it that quickly. That is the kind of coverage you need to get it off of your hand. Keep social distancing, keeping at least, pushing it 6 feet away from people, because you don't want to be that person who happens to be in the group in front of the bank and one person sneezes, and now you want to vex with the person. If you were far enough from the person in the first place, even if the person sneezed foolishly, you knew that you were not that close to them. Okay, so again, keep social distancing. If you have any questions, you can WhatsApp me, you can message me, and I will try to respond. I'll do more lives as I see necessary, but definitely share this with other people who may need it. And I think together we could do this. Together we can do this. It's a scary time. It's a time that many of us have never experienced anything like this before, and could be frustrating, it could be scary, but we can do this. We can do this, and when we come out of this, we would be better for it. We would be stronger, because we've survived one of those evolutionary periods, and we'll be good. We'll be good. So guys, thank you so much for tuning in. Share the information, share the live, and let's do this. Let us do this, because we can do it. We can do it. All right, see you all.